Hello there, healthcare minor aficionados, meds course maniacs. This is your cruise director, Dr. Stuart Swadron, with an update of what's coming this fall. This fall, of course, marks the first anniversary of the foundation of our program, the Minor in Healthcare Studies, and we have a lot of exciting course offerings coming up. Now, just in terms of the big picture, I want everyone to know that we've been working very hard to liaise with the students and faculty of the various professional schools to introduce a mentorship program within our minor to pair up undergraduate students with students in their desired course of study, which for many of you, of course, is medical school. And so we actually have that already up and going, and we will continue to hold events throughout the year to bring everyone together from the various courses and make sure that they feel comfortable on the campuses of the professional schools. So, next, courses. First off, we will be offering the MDA 110 course, the Contemporary Issues and Cases in Healthcare. That's the course that Dr. Ken Geller teaches, our resident pre-health advisor and ENT surgeon. He leads a great course. If you haven't taken this, you definitely have to, where basically every week a different type of specialist comes in. I take part in the course for the emergency medicine part, but there's radiologists, pediatricians. Very, very interesting, fun. And, you know, he really teaches the students to write up medical histories in the same way that you learn in medical school. And I was actually kind of freaked out when I first saw the written pieces that the students do to describe the cases that they get. I was actually kind of freaked out to see how sophisticated they were. So anyway, that's MDA 110. Next, we'll be offering Meds 220 in the fall, and every fall and spring, because it's the most fun that I have all week. And so we will continue to ramp that course up, and we've got even more exciting plans for the next offering. We're going to get students even more involved. We're going to make it more interactive, and we have a whole new batch of physicians that want to come and facilitate for that course. So if you have friends that haven't taken it yet, definitely talk that up. I'm really looking forward to doing the next version of it. Okay, next up, and this is really important, is we're going to be offering Meds 310L. This is a medical histology course. If you're thinking about going to medical school, you really need to think about taking this 4-unit course. It's going to be taught by Dr. Joel Schechter, who's one of the most awarded teachers in the entire medical school. He's a clinical fellow at the Education Institute. He's won all the accolades you can as an educator. He is fantastic. The students love him, and he's who teaches our own med students. So you should really consider taking that. You're going to learn that material really well and have a huge, huge head start. Meds 320, that's our amazing anatomy course where students actually get some hands-on cadaver dissection at the medical school. This is taught by an award-winning faculty, Dr. Michael Habib, who is phenomenal. And I think the evaluations on that course were like 100% perfect from every student. So this is a definite must-take. You'll also work together with medical students. I think it was really fascinating. We had undergraduates and med students actually working on the same cadaver. And the undergraduates were showing up the med students and embarrassing them. It was kind of cool. For those of you that want to take a course with a true medical researcher in the area of molecular medicine and bring together some of the things that you've been studying in your other science courses, we have a fantastic instructor for Meds 330. His name is Dr. Hunan Alayi, and he works at the Institute for Genetic Medicine, and he has a fantastic 4-unit course set up where there will be bridging of the science to the medicine as well in that course. So that's Meds 330. We have Meds 340L. That's a neuroanatomy course taught by, again, 2 of the most awarded professors in the entire institution, Drs. Judy Garner and Dr. Tom McNeil. They are fantastic with students, and they're very popular whenever we can get them to teach at the medical school. This is definitely a great opportunity for those that have already taken anatomy or that are particularly interested in neuroanatomy because they're in the neurosciences. This will give you a leg up on all the rest of your colleagues if you're in the neurosciences or in biology. Meds 360 is from the science end of the medical school. Current research approaches to biomedical problems is a 2-unit course. If you don't want to dip quite into the 4-unit molecular medicine course, this is an option for you. A 2-unit course, and the professor is Dr. Omid Akbari, who is right in the thick of things in the medical school, getting federal grants for medical research. He's one of the true medical scientists in our faculty, and he's fantastic, again, with students and really excited to do this. So that's an important option if you're looking for a 2-unit medical research science course. The next course we have is the Meds 490, which we run every fall, spring, and summer, all through the year, which is our directed research course where we team you up with one of the scientists or clinicians up at the medical school, or in some cases at the other healthcare schools as well. Now, these students, just so you know how this course differs from some of the other research courses, has an overarching curriculum, which means that in addition to you setting your own hours with the researcher or clinician that you're working with and doing the research project, that there are some standard sessions where all of you come together to talk about research ethics and human research, biostatistics as they pertain to medical research, that type of stuff all together. And then at the end, there's a poster session where everyone comes around and there's guest faculty and you get to meet a lot of the players at the medical school. So it's a really great structured research course. Now, there's also last but not least, 2 sections of the 490 course that are designed for people who really want to get their feet in the hospital and specifically in the emergency departments. And these courses are going to be offered at Children's Hospital, which some of you guys have already taken, where you basically join the research team and help enroll patients that are in the pediatric emergency department. And again, they have group activities designed just for that group. And we're also going to be offering that course at the LA County USC Emergency Department, which is very, very exciting, with 2 of our superstar researchers who are also both amazing with students, Dr. Mike Menchin and Sanjay Arora, and that will be coming this fall to the LA County USC Emergency Department for those that are so inclined. So that's a rundown of what we got going on in the fall. Remember, you don't have to declare this minor to participate in this fun, and we really are starting something exciting and having a ball doing it. So I'm looking forward to meeting a lot of new people this year as we all make our way to med school and to our other healthcare career goals. And we'll see you soon.